Rudnicka will talk about oral minoxidil in alopecia. The floor is yours, Professor.
Thank you very much for the kind introduction. Hello, everyone. I will talk about minoxidil. Minoxidil is a game changer in dermatology, especially in the treatment of androgenic alopecia. And today I will cover in very briefly the mechanism of action so that we can review in which diseases minoxidil may be effective. I will focus mainly on the clinical practice, mention a little bit about allergy. I would share with you some data on whether oral minoxidil is more effective than topical, and a few words about the patients who may become pregnant and whether or not we should use minoxidil in such cases. Well, imagine that this is a hair follicle. The hair follicle is surrounded by a dense network of blood vessels. And these blood vessels, the blood supply, is necessary for the hair follicle to keep active. When the blood supply is decreasing, then the activity of the hair follicle is impaired, and over time, the hair follicle will miniaturize. This is the case in androgenic alopecia, but not only. Also in patients who smoke, because of the vasoconstriction, there will be an ongoing miniaturization of the hair follicles. So minoxidil seems like a right treatment for patients with androgenic alopecia because of the vasodilatation. But minoxidil has significantly more activities in different areas than just the vasodilatation, and there are at least 3 areas where it may be important for androgenic alopecia to be the target for minoxidil. It has a local but not systemic anti-androgen activity, and also it has immunomodulating, or maybe we should say immunosuppressive activities, mild immunosuppressive activities. For diseases other than androgenic alopecia, it may be of some importance that it has also other areas of activity. And what has become recently a kind of more importance is the evaluation whether or not minoxidil may be effective in alopecia areata. And here we also look at the immunomodulating part, but focusing on the androgenic alopecia. What do we have available in dermatology? We have the approved drugs for androgenic alopecia, the topical drugs. We have some compound drugs which we can compound, we can let the pharmacy make according to our prescription. There are some drugs or some forms which are under development. This is the sublingual form, which seems to be able to work more effectively compared to the normal oral minoxidil. And finally, what is on the market in many countries is the form of tablets which are approved for hypertension. Why we cannot use the tablets which are approved for hypertension? Well, the reason is that we do not want our patients to develop hypotonia, and then the dose which is used for hypertension is significantly higher compared to the dose which is effective in androgenic alopecia. For this reason, we make the compound drug and we let the pharmacy make it for us. This is the way I write the prescription for minoxidil, and I would like to draw your attention to one issue, to the number of zeros, because there have been many mistakes throughout the world with the mistakes in the number of zeros, which led patients to get a dose of even 10 times higher compared to the dose that was intended. So please take a look at the zeros. What is the typical dose of minoxidil? Well, the typical dose that I usually would start with 1 milligram, and the general rule for minoxidil is that we slowly increase the dose. The reason is that every patient has a different dose at which he or she starts developing adverse events. And for these reasons, I would start with approximately 1 milligram for women, and I would increase up to 2.5 milligrams, sometimes a little bit higher. For men, I usually start with 1.5. However, many of my colleagues start with 2.5. So it depends on the personal preference. And we go up to the dose of 5 milligrams, sometimes a little bit higher. I would definitely start with a much lower dose in patients who are elderly, especially if there are cardiac comorbidities, in patients who are underweight, and also in patients who have a tendency to become hypotensive. Minoxidil is effective both in monotherapy and in combination with other treatments. And when looking at its efficacy, this is a recent article from a few days ago where the authors compared on the basis of articles which are available, because the literature is not really very rich and there were no big clinical trials. So on the basis of literature which is available, they drew the conclusion that minoxidil 1 milligram is less effective compared to finasteride. I'm talking about women now, less effective compared to finasteride 5 milligram, but more effective compared to low dose finasteride. So it seems that a combination of these two treatments may be of benefit to combine finasteride with minoxidil. Few words about the adverse events. The adverse events are usually transient and mild, and the most common adverse event is hypertrichosis, which is present in approximately 15% of patients. Some dizziness or vertigo is present in less than 2% of patients, and the patients may also develop leg edema. What is interesting is that the dose at which women start developing adverse events is much lower compared to the dose at which men start to develop adverse events. And in the case of women, it's approximately 1 millimeter, whereas in case of men, it is over 3 milligram. So because of this, we can start with a higher dose in men. One adverse event, which is very rare, but it's important to take into consideration our patients, is the pericardiac effusion. The pericardiac effusion, it seems to be more common in patients with renal dysfunction. However, I will mention the symptoms just to keep this in mind. It may be the chest pain, the difficulty in breathing, especially when the patient is laying down. But also adverse events which are very common for minoxidil, such as leg edema and vertigo or dizziness. So for this reason, patients who develop these symptoms, like the leg edema and the vertigo, I would either take off minoxidil or I significantly decrease the dose, even if the patient is saying that, well, actually it's okay with the leg edema because it works well for the hair. But still, I'm a little bit afraid it may be the first step into the development of a pericardial effusion, so I try to be cautious in such situations. One quite rare adverse event is edema of the eyelids. It is usually present in the morning, and it decreases and resolves with the decrease of the dose. Basically, all adverse events will improve after decreasing the dose, and less than 2% of patients discontinue the treatment because of the adverse events. A few words about contraindications. This is not so easy because this is not a registered drug, no clinical trials, and no form of registration. So I have mentioned here the contraindications for the 5 milligram tablet for hypertension. This is pheochromocytoma, because minoxidil may increase the problem. But also on the basis of medical literature, that some authors have recently suggested some additional contraindications, such as pregnancy and breastfeeding, which seems obvious, arrhythmia. Even though it was shown that in patients with arrhythmia, minoxidil is tolerated quite well, low blood pressure, and renal disease, just because of the reason I mentioned before, because of the increased risk of pericardial effusion. Few words about minoxidil in children. It is effective in pediatric androgenic alopecia, and the average dose, average starting dose for children is approximately 0.1 milligram per day, so significantly lower compared to the antihypertensive dose, and we increase up to the dose of an average of maximal 1.8 milligram per day. And this is for children from the age of 2 until the age of 17. However, most probably if there's a child who is between 2 and 6 developing androgenic alopecia, then the child would need, most importantly, hormonal examinations, because usually in such young children, if there's androgenic alopecia, there is some background, some endocrinologic background. There's an interesting incident which happened a few years ago in Spain. There were 20 children who were accidentally exposed to high dose of oral minoxidil. The story was that there was omeprazole, which the patients were taking, and the omeprazole was contaminated with high dose minoxidil. So these were 20 children who received this treatment, and the age was between 2 months and 13 years, and the dose was really high. It was almost 1 milligram per kilogram. This means if the child was 40 kilograms of weight, then this would be 40 milligrams of minoxidil for the child. So a huge dose, more than the hypertensive dose. And the average time was over 1 month. Interestingly, the adverse events were quite mild and transient. The most common adverse event that was present in 65% of patients was hypertrichosis. Otherwise, the other adverse events mentioned here, they were present in only one child, and the causative relationship was not documented. So what do we do if the patient has allergy to topical minoxidil? It is quite present. Actually, it's quite common in our patients. We rarely diagnose it and rarely make patch tests which are specifically focused on minoxidil. But if we do, then this is quite a common cause of scalp irritation in patients with androgenic alopecia. There is a study by Michela Starace from the group of Bianca Piraccini, who has shown that in these patients, in 12 patients that were investigated, it was possible to safely treat the patients with oral minoxidil despite their allergy to topical minoxidil. Now, what is more effective, oral versus topical minoxidil? Well, we would think that oral minoxidil is, of course, more effective, but there is one study which has shown that the efficacy of topical minoxidil, 5% topical minoxidil, is equally effective compared to 1 milligram oral minoxidil. I had some doubts. I was also talking to colleagues because we have the impression that oral minoxidil is more effective, but then also it may be the case that the compliance with oral forms is higher compared to the compliance with topical minoxidil. So in our hands, in our patients, our impression, non-scientific evaluation, just the impression is that still we get more good results with 1 milligram, but scientifically it was once evaluated in one study and the efficacy is very similar. What do we do in women who are likely to get pregnant? Of course, in pregnancy, we would not have any doubts, but in women, in young women who are likely to get pregnant, we should not use minoxidil. And why? Not only because of the adverse events for the pregnancy, but also for the fetus. And it was described in quite many cases, the fatal minoxidil syndrome. It was described after topical and after oral minoxidil, after both, with significant vascular malformations, especially in the brain and the nervous system. And there was some hypertrichosis. And however, there are just case reports, so the causative relationship was not proven beyond doubt. What about other types of hair loss? Today I focused on androgenic alopecia, but the dose and the adverse events would be similar in other types of alopecia. And there are many case reports and some studies in alopecia areata that has shown that in every type of alopecia, minoxidil may be effective, usually as a supporting drug, not as the main treatment, but still it is worth considering. In some diseases in which we have no treatment possibilities, such as in molnupiravir, seeing some improvement may be, of course, also of some value, even in monotherapy. So just to summarize, the pathomechanism of action is complex, so this is why we may address many different diseases with oral minoxidil. However, the main target is androgenic alopecia, and it seems that this is the best working combination of oral minoxidil in androgenic alopecia. Other diseases also, this is a matter of discussion and of studies which are ongoing. What is important when we treat with minoxidil is to very slowly increase the dose and to monitor the patient to avoid serious adverse events. With this, if you are specifically interested in hair, I would like to invite you to take a look at my YouTube website, and also I would like to take this opportunity to thank the organizers for the invitation. It was a great pleasure to be here and to meet many friends from other conferences and also from social media. Thank you very much.